What is type 2 diabetes? In the simplest terms, diabetes means that the level of sugar in the blood is too high due to problems with the hormone insulin. People with type 2 diabetes don't produce enough insulin, or the insulin they produce doesn't work properly, known as insulin resistance. Type 2 diabetes doesn't happen suddenly. Blood glucose levels creep up over a few years, and many people have no idea this is happening to them. When sugar levels rise a little above the normal levels, this is known as prediabetes, which is typically only identified during a routine HbA1c blood test, which checks average blood glucose levels over the previous 3 months by measuring the percentage of your red blood cells that have glucose-coated hemoglobin. Glucose sticks to hemoglobin for as long as the red blood cells are alive, which is about 3 months. A reading of 42 to 47 mmol indicates prediabetes, and 48 mmol or over is the point at which diabetes is diagnosed. What are the symptoms of type 2 diabetes? Thanks to successful health awareness campaigns, many people are now aware of the common symptoms of type 2 diabetes: thirst, passing a lot of urine, tiredness, blurred eyesight, and unintentionally losing weight. These symptoms don't tend to happen until the blood sugar is way up into the diabetes range. You are unlikely to experience any symptoms with prediabetes. It can be detected via a blood test. No one thing causes type 2 diabetes. It is caused by a combination of factors. These include your genetics, age, body weight, and where your body stores fat. The reason someone develops it will be individual to them. With type 2 diabetes, a small amount of excess fat inside the organs is the underlying issue. However, it's important for people to understand that they haven't brought this on themselves, as it's not simply caused by obesity or having a bad diet. Only 1 in 2 of all people with type 2 diabetes is obese, and 3 out of 4 very overweight people don't have the disease. It occurs because a person has become moderately too heavy for their own body. We all have our own personal fat threshold or tolerance for weight gain, and problems start when this is exceeded. Stress can also be a factor. High stress levels tend to increase insulin resistance. It's important to reduce stress, but it's one of the hardest things to control. Ethnicity, genetics, and family history all play a strong part in our predisposition to type 2 diabetes. Women who had gestational diabetes during their pregnancy also have a higher risk of developing prediabetes or type 2 diabetes later on. Other factors that put people at increased risk of type 2 diabetes include being from a South Asian, African Caribbean, or Black African background, and having certain other conditions such as depression, high blood pressure, or polycystic ovary syndrome, PCOS. Smoking and poor sleep can also contribute to risk, and we know that people from the poorest households are twice as likely to be diagnosed with type 2 diabetes compared to households with the highest incomes. People with type 2 diabetes should have regular checkups, as it can cause serious complications if it's not well managed. Diabetes is one of the leading causes of worldwide preventable sight loss in people of working age, and a major cause of lower limb amputation, kidney failure, heart attack, and stroke. Poor control of blood glucose is the principal reason that people develop complications. The risk is higher in somebody who has had diabetes for 20 years, rather than someone who has had it for 2. However, we know that we still diagnose diabetes late, so by the time of diagnosis, about 40% of people have complications already. There's a range of treatment options available for type 2 diabetes, and these depend on the stage someone is at when diagnosed. If they have prediabetes or blood glucose that is only just in the diabetic range, they may be able to reduce their blood sugar through diet and exercise alone. Others may be prescribed medication like metformin or insulin, or newer drugs such as Ozempic. The newer class of drugs works by mimicking a natural gut hormone called GLP-1, which is involved in telling your brain that you've eaten enough, along with increasing insulin production and telling your liver to use the glucose better. There is high demand for these medications as they aid weight loss and improve sugars.